Dan Williams, Survive Outdoors. Today we're going to address probably one of the most common injuries there are in the outdoors: hiking, backpacking, rock climbing, hunting, fishing, you name it. Getting in and out of the boat, and that is the ankle sprain. We're going to talk about the assessment of the ankle sprain, and is it broken, what you can do to tell the difference if you can, and the treatment and hiking out. So here we go. So right in the beginning, you want to know, did the person roll their ankle while they were walking, jogging, hiking? Was it just a roll of the ankle? Did they fall from a certain height and then they sprained their ankle and there was a fall involved? Big difference. So if you have a fall from X amount of feet, now you have a high probability of a fracture with the sprain. So really important. I was coaching a basketball game years ago, and this is one of the most common questions that come up. And a child sprained her ankle on the court, and I ran over there, I'm taking her shoe off, and I probably had, automatically when a child gets hurt in basketball, the parents all of a sudden they've graduated medical school, PA school, nurse practitioner school, so they're all physicians. Don't take the shoe off, don't take the shoe off. It'll act as a splint. So if you're in a group, granted, you're going to get a lot of feedback from a lot of people. Let me tell you, you have to assess the ankle. Take the shoe off, okay? Ankle's going to swell. You leave the shoe on, and that ankle's going to continue to swell while they're going to be in more pain. Take the shoe off so you can see what's happening. So, we're going to take this shoe off, and I'm going to run through some just real basic anatomy. Now, I am not going to teach you how to assess between fracture and sprain. For the purposes of this video, this is for the non-medical. What you need to look for, what are the important things you need to look for in terms of getting that person out and how you're going to splint this ankle. So basic anatomy on the foot. What I want you to look at is over here, this is called the lateral malleolus, and this bone over here is the fibula. It does not support much weight at all. Classic fracture of the distal fibula. Over here, this big bone, shin bone, this is your tibia. This is your medial malleolus, this bone sticking out over here. Behind your little toe, this bone is called the fifth metatarsal, and that bone is commonly fractured when you do an inversion sprain of your ankle. So this is a classic fifth metatarsal fracture mid-shaft. And then there's a few other bones we're going to talk about. And I'm going to throw a picture up here of the basic anatomy of the foot. So that's all you really need to know on that. We won't get into ligaments, tendons, way above the necessity of this video. Okay, so you sprained your ankle, or someone sprained their ankle. Did they fall? First thing you look at, does it look correct? Is it angulated? Does it look jacked up? And if it is, well, you're concerned about a fracture, and you're going to splint that in its position. This is a severe fracture of the fibula with shifting to the medial aspect of the way it's angulated. Don't be moving it. If it's not jacked up or angulated or looks funky and it's just excessively swollen, then we're going to go through some splinting techniques right now and show you what some of the things you should carry in your bag when hiking. And some of them are going to be a little impractical. You're not going to be carrying all that bulk. All right, so here are some items that you can carry in your kit. And when I say impractical, some of us are not going to be carrying a SAM splint, this bulky splint, in all of our medical packs. It takes up a lot of room. So you're on a day hike, you're not going to be carrying this most likely. It's an awesome splint. We have the instant cold pack. Really, really lightweight. They're nice. You shake these up, pop them, and they instantly get cold. And those are really helpful. You may want to carry one of those in your pack. We have Leuco tape, which is great for blisters. It also helps in taping an ankle. We're going to show you that in a minute. We have Medi-Rip, and we've used that in numerous videos, and you can use this to wrap an ankle. And then there's everybody's favorite, which is not mine, and that is the good old Ace Wrap. And we're going to talk about the Ace Wrap, and the Ace Wrap is really, really good for getting sympathy from loved ones and friends and peers alike, but it doesn't do much for an ankle sprain or a wrist sprain or anything like that. It does offer some compression, but that's about it. So I'm going to go through some basic assessment tools before we wrap. So there's 3 grades of an ankle sprain: grade 1, grade 2, grade 3. A grade 1 sprain is the most minimal. And let me tell you, these are very subjective. The most excellent orthopedic surgeon is going to have difficulty sometimes assessing between a grade 1 through grade 3 just by assessment. So grade 1 could be a partial tear of a ligament, tendon. Grade 2, incomplete tear, more swelling, more pain. Grade 3 is pretty easy to recognize. That is complete tears, and the ankle is unstable and basically wobbling. Functionally, how you can tell those grades apart: a grade 1 sprain is someone can walk and bear weight on that ankle. A grade 2 sprain, they limp a little bit. And a grade 3 sprain, forget about it, they're not walking nowhere. Again, it's somewhat of a subjective assessment. I get patients come in, well, what grade is it? What grade is it? And I explain that to them, that there's some subjectivity in this. Then years and years and years ago, a doc up in Canada, they had the Ottawa rules. The Ottawa rules are rules that it's an assessment tool that tells us whether or not the person needs an x-ray. And believe it or not, with this assessment, it's about 95% sensitivity in terms of do they have a fracture or not. And what's really interesting about this is, yes, it helps in determining whether or not they need an x-ray. But anymore, everybody sues at the drop of a dime. So as providers, we're still probably taking many unnecessary x-rays of the ankle. But in the outdoors and you're hiking, these Ottawa rules are not bad to go by. So what are the Ottawa rules? There's 5 Ottawa rules, 4 with an addendum. So one of the things that you want to look for is, do they have pain over this lateral malleolus? Do they have pain at the base back here behind the little toe? This is that 5th metatarsal, that's 2. 3, do they have pain over this medial malleolus? And then there's a bone here called the navicular bone, which sometimes can get fractured, and you push on that, and do they have pain there? And that's the 4. And then the 5th is, can they take 4 steps? Can they bear weight with 4 steps? Those are the Ottawa rules. If they don't have any of those, 95% confidence level, it's not broke. All right, so let's jump into how we're going to splint this. So let's use, or basically, first we're going to wrap it. So Ace Wrap, the one I just love. So the Ace Wrap, I get people that come into the clinic, you get your 15-year-old, they sprain their wrist, and they got 2 of these wrapped on. They're in a lot of pain. So when you wrap an ankle and you're going to wrap it, start from the ankle here first and come up. And then for each wrap that you do, what you're going to do is you're going to go up the leg. And for each wrap, you're going to go half. See that? Half. Half. And what this does is it makes even compression on your ankle. You're going to come around and you do half. And you're doing half again, and you're going to come up. So that is the same. Now watch. You know, I have full range of motion of that ankle. This is why, you know, Ace Wraps are pretty well worthless. They do help a little bit. You've heard of high ankle sprains and athletes getting high ankle sprains. How do you assess a high ankle sprain? One of the methods you're going to push up high, and you're going to push the tibia and the fibula together. If they have pain up in here that's severe, then that's a high ankle sprain. A lot of times we'll wrap those pretty tight, and they will get an x-ray. Highly unlikely they fractured something. And this is one of the dilemmas with a high ankle sprain. The person's in a lot of pain. However, they don't get a lot of swelling. Needs to say a coach or athletic trainer is looking at it, go, nah, not a big deal. Very little swelling, doesn't get really black and blue, and they have a severe high ankle sprain. All right. So with the MediRip, you can wrap this up, and it's a lot easier because it clings to itself as opposed to the Ace Wrap, as you can see. And it's still the same technique, half, half, half. So the other thing you can do with the SAM splint, which is nice, you can do, it's called a sugar tong. And a sugar tong splint just looks like a pair of sugar tongs. When you grab a sugar cube, is that you're going to splint this and mold this on each side of your ankle like that, and you're going to come across with you know, the MediRip all around, and you're going to secure this and keep their foot 90 degrees, and you're going to come across, and you can actually take this and do this really tight, because the splint itself is going to stop from putting too much pressure. So you can put that on there, and that works really well. And if you keep it tight, you're not going to have a lot of movement. So that's the sugar tong method that works well. You can also take the SAM splint, and then you can do an S or figure 8, where you take it here, you run it below your foot, and you're going to cross it like that and come across, and that is a nice, also another splint that you can use on the foot. So the leukotape. What you can do with this is how I would basically start. I'm going to take, and about 4 inches above the malleolus, I'm going to put, wow, that's hard to cut. I'm going to put a strip there, and then I'm going to come underneath, attach it there, keep the foot at 90. I'm going to run this under the foot, over the medial malleolus, like I have here, directly over the lateral. Like that. And then I was showing you the last one with the SAM splint. You can come across here, or you can come across this way underneath. You can come over and around like that. Then you're going to do the same way on the other side. Once you have this base layer here, then you can come on and splint it with your more rigid splint. You're also going to have to be creative. What if you're not having any of this? Get you some bark from a tree. Birch bark wouldn't do it. Too flimsy. Find some bark, cut some bark off a tree with an axe or a knife, and use that. I've even seen people use ski poles. They've even broken them in two just to get a shorter splint. So you're going to have to be creative when you're outdoors. So one of the other things you need to look at is the color of the foot, and do they have feeling? So are they neurovascularly intact? I've probably only had 4 cases in my life where they were that bad, and they got shipped out immediately. So look for that, just in case that happens. You need to get back ASAP. So what is the treatment? Treatment for a severe ankle sprain. RICE, R-I-C-E, rest, ice, if you have it, compression, which we've talked about from the foot up, elevation above the heart. Now, if you suspect a grade 3 or a grade 3, or you suspect a fracture, you need to get them out. You need to get them out of the area and start heading back. Now, if you have 3 or 4 people, it's nice to take turns. Sometimes you can carry. Sometimes you can create a sled with some paracord and some sticks. That's a little extreme. If you have an axe, what you can do is cut you off make a cane, make some crutches. This is one I've been working on, just not for a crutch, just for a walking staff. Been working on this for about 10 months. And it ironically is, you want it to come to right to your armpit is where you want it. And 90% of the time, I'm having people put it on their healthy side, not on the injured side, because they're going to be able to add more weight. And this is going to hurt like hell in their armpit. So take you a coat, take you a tarp, a poncho, take you some paracord, wrap that up, and they will thank you. And put that on their uninjured side. They are going to bear their heavy weight on that, and they're going to, now sometimes in severe cases, I will have somebody put this on their injured side, but the vast majority, it's on their healthy side. Or you can make crutches. So you need to be innovative when you're in the outdoors hiking. You want to splint it, you want to secure that ankle in position, you want to get them out of there, give them some Tylenol, ibuprofen, take frequent breaks, have it elevated above their chest. That is your ankle sprain assessment and treatment in the outdoors. Don't forget, just our last video, we're giving away a free backpack. $100 value, 511 Rush 24. Check out that video for all the rules. Any questions, comments, advice, suggestions on ankle sprains, write them down in the comments. Keep your eyes on the horizon, face to the wind, stay safe, guys.